Good evening. This is Ty Morton, a student at the University of Phoenix, for Nursing 540, Professor Marcia Eaton. What I will be discussing today is a lesson plan that I plan to do for my practicum project at Weissman Children's Rehabilitation Hospital, located in Marlton, New Jersey, with the audience being nurses and nursing assistants. The course description is focused on pediatrics, which includes infants and children of other ages that have critical airways. A key focus is in providing nursing staff with knowledge and skills needed to handle medical emergencies with children with critical airways. Children with critical airways can include children with tracheotomies and ventilators. The modality that I'll be using is a synchronous modality. I will be giving face-to-face instruction to the class. The instructional design model that I'll be using is the 80 model that analyzes the learner characteristics as well as the materials being used for the class. I will be providing an introduction to the students and also asking the students to introduce themselves and their job title. I have designed learning objectives for the course, develop materials and content to be used for the course. I will be implementing the content that's available, and at the end, evaluation will take place. The instructional design method that I have chosen to use is the adult learning method, which is geared towards teaching an adult population. Many of the population are adults. Actually, they all are. Different age groups. So I will be providing education relevant to the clinical setting, allowing each student to engage and also be self-directed in their learning with the use of props and visual aids. I will also be giving visual handouts for them to read on their leisure and to ask any questions that they may have. The visual handouts include an excerpt from the first edition of Avoiding Common Pediatric Errors with the title, Consider the Broad Diagnosis for Respiratory Distress in Children. Another article is Basic Nursing Principles of Caring for Patients with a Tracheotomy. The topics and objectives for this course are recognizing when there is an emergency and emergency care for pediatric clients with critical airways. The objective is for the student to verbalize at least 3 signs and symptoms of respiratory distress and 3 signals that an alarm may sound for an emergency situation, to be done by the end of the course. Nursing assistants will be able to verbalize what signs and symptoms they need to report in case of an emergency to the nurse. Nurses and nursing assistants will be able to demonstrate the proper care and protocol needed to attend to a patient having a medical critical airway emergency. I will help them to understand the proper policy and protocol in transferring a client to another healthcare facility if need be. Part of educating the student is taking into consideration Bloom's taxonomy, the cognitive, affective, and psychomotor domain in instruction. The cognitive domain is moving from the more simple to complex instruction, helping the student to gain more decision-making and problem-solving skills. I will be talking about the basics of respiratory distress, including verbal and visual tools to help them with the memory and to help with initiating the best practices for providing care of patients with critical airways. I will also be tapping into the emotion and motivation of the student, their readiness for learning, which will assist in helping me with enacting the affective domain, and also providing props and teaching and learning about what to look for in case of an emergency, which is more skill-based, where I can enact the psychomotor domain. Industry standards that I am using, that I am basing my instruction on, is the QSIN standards, which makes sure that nurses have skills and knowledge as well as attitudes for quality and safety in healthcare, and the New Jersey Board of Nursing, which protects New Jersey residents by ensuring the competency of nurses giving care. The content that will be covered in the class are faculty responsibilities, which will be noted at the beginning of the class as well, offering knowledge to the students. My job is to follow organizational policies, support and guide the nurses in the educational process, promote engagement, and collaboration with other stakeholders. The responsibility of the student is to gain information for healthcare policy, engage in the educational process with the support of the instructor, expression of concerns, ideas, and needs, and offering feedback with participation in the evaluation process, as well as obtaining resources that may be needed for future reference. The teaching strategies that will be used is a small lecture with visual handouts and props. There is a video that students will be able to obtain in their leisure, which will also engage in more self-direction and autonomy in their learning. The video is emergency care of a child with a tracheotomy or ventilator. At Weissman Children's Rehab Hospital, the goal is to provide safe and quality care that is compassionate to patients while providing education and preventing further disability and pain. The content and objectives of the course align to the mission and value and vision of Weissman Children's Rehab Hospital. It is my job as an instructor to make sure that the content aligns with the objectives and that the students get the best quality experience of education that they need for providing the best care to patients. The materials that I'll be using is handouts and props, including a ventilator that's not in use, samples of different kinds of trachs, suction catheters, an ambu bag, pulse ox CR monitor. We'll also need computer access and printer for handouts. And that concludes my discussion on the lesson plan. Thank you very much.